So in 2021, we developed FLT3-like signature based on gene expression profiling of acute myeloid leukemia. This FLT3 signature was capable of identifying patients who have FLT3 wild-type AML, but whose gene expression profile resembled that of patients with FLT3 ITD mutation. And by that time, the PETEMA group was developing a clinical trial in Spain aimed to treat patients with FLT3 wild-type AML with Quizartinib plus chemotherapy or placebo plus standard chemotherapy. And the question was, is the FLT3-like signature capable of predicting responses to these FLT3 inhibitors in FLT3 wild-type AML? So what we did was to recover all the samples from the clinical trial, process them through RNA sequencing, and reproducing the signature, and we actually observed this distribution of patients in FLT3-like and non-FLT3-like signatures, and then we analyzed if this had any actual value for prognostication or actually predictive response to Quizartinib over standard chemotherapy, and we observed that FLT3-like patients, these were benefiting more from Quizartinib than standard chemotherapy, whereas the non-FLT3-like patients were not actually benefiting more from Quizartinib over placebo. And then we correlated this with mutational signatures that we know are correlated with the FLT3-like signature, for example, NPM1 and DMT3A mutations. And we actually observed that those FLT3-like patients who have NPM1 or DMT3A mutation are the ones who have the greatest benefit of this drug combination, chemotherapy plus Quizartinib, over the placebo group. And conversely, those patients that have NPM1 mutation or DMT3A mutation but do not pertain to the FLT3-like signature, these do not get an additional benefit. So pretty promising biomarker for combining with NPM1 and DMT3A mutation in order to select patients who will actually benefit more from Quizartinib in FLT3 wild-type AML.